All right. So we are going live. It's actually our first YouTube live at the practice.
Mhm.
So we'll see how this goes. Just give us some grace if this flops. But it's that time of year, and we know a number of our patients have allergies, and we thought we'll come in and sort of talk a little bit more about allergy testing and what that entails. And because again, a lot of you who have commercial insurance have met your deductibles, and this is a great time to be able to get your allergy testing done. So there's less out of pocket cost for you. But it's a very important service. And just in case we haven't met, I'm Dr. Obidi, pediatrician at Partners in Pediatrics and Adult Care. We are primary practice taking care of both adults and kids in the Hagerstown, Washington area. And with me is Miss Crystal, who is our allergy MA in our allergy lab.
Yeah.
And she is fantastic. She's been with us for ages and does this really great. Well, age is not that
No.
she's sweet 16,
Yeah.
but she's really, really expert at this and has done this for quite a while now and lots of experience. So we thought we'll hop on here and have a chat about allergies, right?
Sounds good. Yeah.
So why do we even bother testing in the first place, right? A number of people have environmental allergies, and it can be really miserable depending on the time of year and the allergy, what their allergies are. They can have symptoms that range from itchy eyes to watery nose, very stuffy, some cough,
Yes,
right?
that
Exactly.
annoying cough.
Annoying cough. And sometimes there are even some other conditions that, we don't even think about that can be affected by allergies also. Maybe they're having some difficult time with sleep because they're very congested. Some kids sometimes are very hyperactive, and we start to think maybe they have ADHD and it's really their allergies bothering them. Just a number of different things. Lots of ear infections or respiratory infections when you have allergies that are not under control. So there's a number of good reasons why you want to get that under control.
Yes.
And oftentimes we'll first start with conservative treatments like, over-the-counter medications. Well, first of all, just simple things like silly nasal rinses, and using things like that. But then you could use antihistamines over the counter like Claritin or Zyrtec. Those are just brand names, Allegra, or the generic forms. But sometimes all that hasn't helped. You've maybe gone through a couple of seasons of using those and they're not helpful, or you have very bad side effects from them. Maybe they make you too drowsy, or just dry out your eyes, or just, are difficult to handle. And so some people end up doing really well with immunotherapy, which are allergy shots, to try and help your body get used to the allergens so you don't react as easily to them, right? And this is where, you come in, Miss Crystal. So what kinds of things do we test for when we're testing patients with for allergens?
Sure. So we test for pet danders, tree pollens, grasses, molds, weeds, and fungus. So all those environmental allergens.
These are all the
that we
common
just can't
things,
avoid.
right? Yes.
Mhm.
And at the end of the day, how many different allergens, usually if you separate the different kinds of molds and grasses and trees and that pet dander, like roughly about how many different allergens that we typically testing for, like a range?
Test for 58 allergens.
58 allergens.
58.
Yeah, that's
super
a lot.
Easy. Yeah,
very easy, but very
easy.
super easy. And we're going to talk about how that's done in a little bit. But that's really important because depending on where you are, in our area here, the different grasses, different trees, different molds, people have different pets they may be exposed to, and each of those have different allergens that people can react to. So it's good to be able to test for all those things to see if any of those may be the offending cause. And then what happens if they do test significantly for any of those allergens? What do you do with that result?
Sure. So if they test positive, then we talk about the possibility of immunotherapy, which is essentially allergy shots. But the great part of our program is we can teach them how to take it home and do it.
Yes.
Or we're happy to do it here in the office as well. Yeah, whatever works best for their schedule. It's part of the beauty of this program.
Yeah, it makes it very flexible because a lot of other allergy programs, they have to come to the office to get that done.
Yes.
But the allergen immunotherapy is produced in such a way that it's safe to be able to administer that at home, and of course lots of teaching goes into place, and lots of safety protocols to go through and make sure that it's done safely at home.
And I'm here and available for any questions at any time. So make sure that everybody has all of my contact information. But it takes about 10 minutes in the office. We put some
so why don't you go ahead and tell about exactly how you get that done.
Super easy. So this sits down in the antigens that we're testing for. I pick it up, I kind of rub it on their arms a little bit. The hardest part is waiting those 10 minutes because it may get a little itchy and you can't scratch it.
No, I can't scratch it. I'm waiting.
Yes. But I usually find plenty to talk about, and we try to keep.
She's a good conversationalist, so usually she keeps them busy.
So we just talk about some things, and those 10 minutes passes right by. I just measure them, and we talk about it, and
if they meet a certain threshold, like if they have a reaction that's over a certain threshold, then you know that's positive for that particular allergen.
Exactly, and everybody's different, so I explain the test to each person, how that test looks for them, and what their positives are, and then explain how we can help them and see if they're interested.
Wonderful. Well, so there you go. Very easy. You know, the device is very simple. I know sometimes people are, and in a long time ago, it used to be needles that you used to prick people. So sometimes when people think of allergy testing, they're thinking of needles, right? But this is just a plastic, really hard plastic.
Kind of like a stamp.
Really, yes.
It almost looks like a stamp. So, each one of these has 10 prongs.
Yep, little 10 prongs in there, but they don't break skin. So she just dips that into the allergen and then puts that on your skin and gets the allergen on. So that's super easy.
Super easy.
Very easy to do. So,
and in 10 to 15 minutes, we'll know what you may be allergic to.
And then come up with a game plan to help with that. All right, well, there you have it. Really simple. Just wanted to hop on real quick to explain what allergy testing is all about, just in case you're wondering. And if you're a patient here at the practice and you're interested in getting allergy testing, just go ahead and call the office at 301-791-7060. I'll be happy to schedule you in with Crystal over here. And usually you'll see one of the providers first to make sure it's a good fit and that, you know, you're the right patient that we will require allergy testing. So we'll schedule you for that visit, get you scheduled for allergy testing if it's appropriate for you, and get you on your way to hopefully some better experiences during allergy season. So absolutely. Again, this is the best time to get it done, especially if you have a large deductible. A lot of people have met the deductible or at least gone closer to it. So it's not as much out-of-pocket cost. But we're happy to have that conversation and let you know what that would look like with your particular insurance. It's not an issue. That shouldn't prevent you from coming in to talk to us about that. All right? Absolutely. Yeah. And if you're in the Washington County area and you're looking for a wonderful place to take care of you, we are a primary care practice. We take care of both adults and kids, and we'll be more than happy to see you. So just call the office at 301-791-7060. Yeah? Yeah, sounds great. We did it. Thank you. Not too bad. Thanks. All right, take care, everyone. Bye-bye. Bye. Yeah, that wasn't that wasn't bad, right? Yeah, not bad. I was like, oh, shit.